Welcome to the University of Louisville Family Medicine Residency at Owensboro. I'm Dr. Darby Cole, Residency Program Director. Let me tell you a little bit about myself. I'm a Kentucky native and I went to medical school in the state of Kentucky at the University of Kentucky in Lexington. Graduated about 27 years ago and went into private practice out here in Western Kentucky. After doing that for about 20 years, I got involved here with the residency program. That 20 years of experience of practicing primary care medicine in a rural underserved area gave me a really unique perspective on healthcare, and particularly healthcare and rural healthcare here in Western Kentucky. Now let me tell you a little about our residency program. The Owensboro Health Family Medicine Residency is a community-based program that is affiliated with the University of Louisville School of Medicine. Go Cardinals. Our program is unopposed, so you will not be competing with residents from other programs for patients, procedures, hospital resources, and even face time with faculty and other clinical staff. We're located in Owensboro, Kentucky, which has a population of around 60,000. Davis County has a population of about 120,000. Owensboro is a centrally localized city, being about an hour and a half away from Louisville and 2 hours away from Nashville. We're also only about 3 hours away from places like Cincinnati, Ohio, St. Louis, Missouri, and Indianapolis, Indiana. Owensboro Health Regional Hospital is a 477-bed acute care facility that serves a population of 500,000 within the surrounding communities. Because of this, the hospital has one of the busiest emergency rooms in the state. We see about 70,000 patients a year in our ER. All entities of the Owensboro Health System use the Epic medical record system, so departments and clinics can easily communicate with each other and share patient information. Our program is a 3-year program that has 6 residents in each class for a total of 18 residents. We welcomed our first class in July of 2020, and we will have our first graduation in June of 2023. One of the strengths of our program is our faculty. We have a host of tremendously experienced and knowledgeable faculty that are energetic and very willing to teach. In addition to myself, we have folks like Eddie Marshall Prunty, who has about 40 years of experience in family medicine and has a background that included a fellowship in obstetrical training. We have Dr. James Price as one of our faculty, who in addition to being a family medicine physician is also board certified in occupational medicine and is an OMT champion that leads our OMT and research curriculum. We have a pediatrician on staff here, Dr. Stephanie Hayden, who helps out a tremendous amount with precepting in clinic, teaches, of course, our pediatric didactic curriculum, and is an all-around assistant to us and in our success here in our clinic. We have a clinical pharmacist on staff with us. Her name is Elise Tharp. She has a tremendous background in learner education and teaches a lot, including our anticoagulation education on hepatitis C. She teaches classes on antiarrhythmics and has a host of knowledge in the cardiovascular world that helps us out here in clinic. We also have a faculty member, Cheryl Knopfsinger-Lynn, and Cheryl is a behavioral health specialist. She's an LCSW with many years of complex trauma-based counseling and a lot of work in behavioral health that has put her in a position of excellence leading our behavioral health curriculum as part of our didactics. Also this coming year, we're planning on hiring Dr. Damon Kolak and Dr. Hayat Itani. These are 2 of our 3rd-year residents with prior experience before coming to us that plan on staying on after they finish their training here. Our curriculum is composed of a 13-block schedule each year. Each year, there are 3 months of inpatient service involvement for our residents. There's no night float or night call during your internship year. There's a lot of different things we have included in our curriculum to maximize your education and your experiences during your time here in Owensboro. We have a very strong, as I just mentioned, a very strong inpatient curriculum. But you'll also have exposure to a lot of other aspects of the hospital, including the OB labor and delivery wards, the newborn nursery, and the NICU. You'll have time during your internship year to spend a full month in the ICU. You'll have time for research, you'll have a behavioral health experience, you'll have inpatient and outpatient lectures. These include adult series, pediatric series, maternity care series. You're going to be exposed to procedure workshops where you learn to do things from circumcisions to laceration repair. You'll get instruction in practice management. You'll get instruction in how to develop a wellness curriculum. You will be involved in intern support groups, and you may even be involved in giving lectures to medical students. A couple of unique things about our program: we actually require an original research project during your 3 years here. That takes you from being a consumer of medical knowledge to actually being an originator and creator of medical knowledge. We also are going to expose you to the intricacies of patient safety projects, and we're actually going to require a couple of those things from you during your 3 years here in our program. We have only one away rotation as part of our curriculum, which happens during the first year. The rotation is the inpatient pediatric rotation, which occurs at Norton's Children's Hospital in Louisville, Kentucky. We provide an apartment there for you, some free parking, and easy access to have that rotation experience. Our curriculum also allows for elective rotations. Residents have a total of 3 electives during their time here. One of those is during the second year, and 2 of those occur during the third year. Elective opportunities include experiences at rural off-site clinics, occupational medicine, plastic surgery, oncology, hematology, wound care, dermatology, and possibly many others. Other benefits of our program: well, in addition to a robust education, our residents receive a $12,000 sign-on bonus when they start, and moonlighting opportunities are available for those in good standing. They also have free access to our Health Park fitness facility, which has 2 indoor swimming pools, a basketball court, a gymnasium, walking track, a variety of fitness classes and programs, and is the only certified healthcare exercise facility in the state of Kentucky. What's the conclusion to all of this? Well, the conclusion is that we have a wonderful hospital in a wonderful community with a top-notch program and a very tough curriculum that will prepare you for all the challenges that you're going to encounter out in the real world practicing medicine. We hope you visit our website and watch our additional videos online to help you visualize our amazing facilities. We look forward to your interview and hope to learn more about you during this process.